Welcome to Maryland Health Today. I'm Ellen Beth Levitt. Menopause is a natural transition in a woman's life, not a medical problem, but many women have a tough time with menopausal symptoms, and they're looking for safe and effective ways to get relief. On the show today, we'll hear the latest information about menopause and dispel some of the myths. My guest is Dr. May Blanchard. She's an OBGYN at the University of Maryland Medical Center. And Dr. Blanchard is also an assistant professor of obstetrics, gynecology, and reproductive sciences at the University of Maryland School of Medicine. Welcome to the show.
Thank you. It's a pleasure to be here.
First of all, the word menopause. What does it mean and where did it come from?
Menopause is a Greek basis of two words, men meaning month and pausis meaning cessation. So it refers to the time in a woman's life when her periods cease.
I always thought it was weird that it said menopause. It should probably be womanopause. That's interesting. At what age do most women enter menopause?
The average age of menopause is 51 to 52. However, women will start to have irregularities in their menstrual cycles well into their 40s, anywhere from 2 to 8 years before the actual end of their menstrual cycles.
And what is the definition of menopause?
Officially, we say a full year without having any periods. A woman is then into menopause.
What kinds of factors determine when a woman will enter menopause?
Well, there's many things that, and there are many myths out there as to what can affect menopause. A woman typically will go into menopause around the same time her mother did. However, having an early start of her periods as a youth does not necessarily mean that she will stop her periods any earlier than her peers. Some of the factors that can lead to an earlier onset of menopause include things such as smoking, low body weight, living at high altitudes, and alcohol can actually delay the onset of menopause. Some things that we know don't have any effect on the timing of menopause include things like birth control pill use, or race, socioeconomic status.
Why would living at high altitudes affect when you begin menopause?
Some of it may be thought to due to physiologic changes as far as oxygen and stressors on the body, oxygen needs at living at higher altitudes.
And as far as diet goes, what kind of diet would make a woman more likely to go into menopause early?
Well, someone who is a vegetarian, and it goes along with the whole concept of perhaps decreased nutritional status, those women tend to go into menopause at an earlier age. Definitely having a balanced diet from a complete health standpoint is beneficial, and consequently, change in diet or low fat content, low body weight can lead to an earlier onset of menopause.
What is perimenopause?
Again, peri has a Greek root, and that means surrounding. So it's around the time of menopause. And we use it to describe the time when a woman basically starts to have fluctuations in her menstrual cycle. The average menstrual cycle length, and when we talk about menstrual cycle lengths, we're talking monthly from the first day of the period until the next period starts. So the typical menstrual cycle length is about 28 days in the average woman, but it can range anywhere from 24 to 35 days, and that's all considered normal. In their 40s, women will often notice that their cycles start to get longer in length. They may start to skip periods, and they may start to have symptoms of hot flashes, night sweats, sleep disturbances. That may all be signs of perimenopause.
Can a woman become pregnant while she's in this perimenopausal period?
That's a really good point. Yes, she certainly can. During this time, a woman's ovaries are starting to get depleted of functional eggs, and she's not ovulating. She's not releasing an egg each month, typically, as she might have earlier in her reproductive life. However, she may still release an egg, and therefore she could still become pregnant during this time period. So an effective method of contraception, whether it's a barrier method like condoms or diaphragm or something hormonal, is recommended unless she chooses to get pregnant.
What is happening in a woman's body when she has the symptoms of menopause? You mentioned hot flashes and so forth. Is there something going on with temperature regulation in the body?
It's actually an abnormal release of heat regulation. So the hot flash symptom or phenomenon many women can describe to you, and about 75 to 90% of women will experience hot flashes as part of their perimenopausal, menopausal symptoms. Not everyone, and not everyone's affected the same way. So some may have hot flashes that occur several times a day. Others may have them very sporadically, and they may cause minimal disruption to their lives. But for most women who do have hot flashes, they describe it as a feeling of warmth that comes over their face and torso. Oftentimes they will also start to have a flush or a visible blushing, and sometimes begin to perspire. And then the core body temperature actually drops, so then the woman has sometimes a shudder, and it's thought to be thermoregulation kind of gone awry. It's not real clear that it's linked specifically to estrogen, but there are hormonal changes that are seen in laboratory studies that are associated with the hot flash.
It's interesting that there's that connection. And I guess night sweats are really hot flashes while you're sleeping, right?
Correct, correct.
Now, some women say that they also have some memory problems or mood disturbances. They get grouchy or whatever as they're going through menopause. Are these also tied in perhaps with the drop in estrogen?
Well, the official drop in estrogen isn't necessarily documented until about 6 to 12 months before the periods stop. And some women will have perimenopausal symptoms anywhere from 2 to 8 years prior to that. Mm-hmm. So I think it's a lot of hormonal fluctuations that are going on beyond just estrogen. But I think you're mentioning estrogen is because estrogen is a very effective method at treating symptoms like hot flashes. As far as the mood and the memory disturbance, it's hard to say how much of that is separate from the fact that oftentimes that same woman will also be having sleep disturbances and hot flashes and many things that are affecting her quality of life, and that may consequently affect her ability to sleep and feel rested and to stay alert and function the following day.
Oh, so that's where those other symptoms might come in, from not getting enough sleep or being distracted by hot flashes and that sort of thing.
It's certainly a factor.
Right. Does being overweight affect whether or not you're going to have stronger symptoms from menopause?
Well, we know that women who are heavier, have increased adipose tissue, will have higher circulating levels of estrogen.
Is adipose tissue fat?
Yes.
Okay.
Right. So the fat cells they participate in conversion of steroids, the precursors of estrogen, to estrogen. There are at least 3 main types of active estrogen in a woman's body: estradiol, estrone, and estriol. And those are all affected by conversion in the fat cells. So a woman who has a higher content of fat cells is potentially going to have higher levels of estrogen available to her, and that may contribute to less severe symptoms of the perimenopause.
Oh, and that's why perhaps you were saying women who have a low body weight might go into menopause earlier.
Correct.
Because they don't have the sort of that excess storage of fat that creates the estrogen
That's
for
right.
them for a longer period of time.
So in addition to their ovaries producing less estrogen, their body tissue is also producing less.
Why do some women breeze through menopause with virtually no symptoms while others are really bothered by the symptoms?
That's a great question, and that's hard to say. Sometimes people have found that diet, exercise, a lot of behavioral modifications may help their ability to cope with some of the physiologic changes, and some women just aren't as affected by the physical symptoms.
If your mother didn't have many menopausal symptoms, is it likely that you'll also have the same experience?
I don't think there's any predictability there.
How long does it take for these symptoms to go away? Are they temporary in terms of maybe lasting a few months and then they disappear?
Again, that's going to depend on the person. In general, studies that have looked at symptoms, most typically hot flashes, because that is most often what women will complain of and are most debilitated by, those symptoms should go away in about 4 years on average.
Great. Well, we have to take a break, but when we come back, we'll talk about treatments for menopause symptoms, so stay with us.